Welcome to the first Provost lecture for 2018. It's a great pleasure to have Dr. Christina Maslach here as we prepare to do our very best to address a challenge that's facing our academic medical center as well as many institutions around the country, and that is burnout. According to Burnout Among Healthcare Professionals, a call to explore and address this under-recognized threat to safe, high-quality care, which was published by the National Academy of Medicine in July 2017, more than half of U.S. physicians report significant symptoms of burnout, which is characterized by emotional exhaustion, cynicism, and a low sense of professional accomplishment. This phenomenon, we know, also extends to other healthcare providers as well. But there's more. Patient safety is also at risk. Various studies have shown that this issue of provider burnout, medical error, malpractice suits, and even healthcare-associated infections are linked. These things are all linked. So it's my hope that this lecture will be a catalyst for us here at UTMB as we begin more conversations of our own about a way forward. So Dr. Maslach is a pioneering expert in job burnout and related challenges. You may have heard of the Maslach Burnout Inventory, or MBI, that's considered by many to be the leading tool to measure stress. She's also founding co-editor of the electronic journal Burnout Research. She received her bachelor's degree from Harvard and her PhD from Stanford. Her numerous publications include The Truth About Burnout and other award-winning articles, such as Early Predictors of Job Burnout and Engagement, that was published in the Journal of Applied Psychology. This particular article was honored in 2012 by Emerita Management Reviews as one of the 50 most outstanding articles published in any of the top 300 management journals in the world. But rather than list more of Dr. Maslach's many accomplishments and honors, I'd like to tell you, as is my wont, about an early influence that she says had a great impact on professional life, and she told us about this story. So when she was starting graduate school in social psychology at Stanford, she was like any, perhaps a new graduate student, excited about her chosen career path and eager to connect with other members in the field. So naturally, she began attending the American Psychological Association's annual conventions. The first convention she attended was in 1967. This was the same year that Dr. Martin Luther King Jr. delivered the invited distinguished address. Some of you may have actually read that speech by Dr. King. He challenged social scientists to do more to help change American society. He spoke of the civil rights movement and how that movement needed psychologists and other scientists to educate Americans about the harsh realities of racism. He also said that the Vietnam War, quote, left our country politically and morally isolated in the world. Dr. King addressed many specific social and cultural crises of that era in our country. In the audience, I'm told, a young Dr. Maslach was moved by Dr. King's powerful words. She was not only inspired by his call to action on specific issues, she says that Dr. King's speech sparked a broader question in her mind. How can I contribute to the betterment of society? On that day, Dr. King said again, quote, for social scientists, the opportunity to serve in a life-giving purpose is a humanist challenge of rare distinction. So this is just one of many, I think, impactful experiences that Dr. Maslach says has stayed with her throughout her career. But I think it gives us an idea of what motivates her to continue her work and to help us in healthcare as we address this issue of burnout. So without further ado, Dr. Maslach, thank you very much.
Thank you. So thank you very much for inviting me here and to talk about all of this. And thank you very much for that kind introduction. I mean, that was one of the most moving moments I had in my life, was to hear that speech and what it meant for the field that I was going into. So I thank you for alluding to that. So I'm going to be talking about burnout. And I first want to say that the research that I've done has actually been not just in healthcare, but in many other occupations and, different kind of organizations and so forth. And I thought before I would start getting into the healthcare issues that I might quote from some of the other interviews that I've done over the years, just so you hear kind of what's happening in other places in the world. And then we'll get into the healthcare. So this is from an engineer in a public works institution. And he said, a large problem is that the company is always moving in new directions. And this is done in secret without receiving input from the professionals who actually perform the jobs. It makes us feel devalued when changes are made to a department or program, but the staff is never consulted or asked what could be done to improve their job. This was someone who worked incredibly hard, really cared about the job and so forth, and just was, can't I play a role in some of this? Or is it, and was reporting things about burnout. Here's another one. I love my work. I'm an avid learner, a very positive person, but I work in a socially toxic workplace. This is a highly political environment that encourages competition between colleagues, backstabbing, gossiping, hiding information. I find going to work very difficult, and I come home exhausted. Or here's another one, a consultant. I was working at a prestigious firm and earning a good salary, but having serious disagreements with my bosses over practices that clashed with my values and sense of identity and self. After I pushed back a couple of times and said that what we were recommending wasn't right for the clients, my boss cranked up the pressure on me and assigned me only the most difficult clients. At one point, I said to my wife, it might be good if I got hit by a bus. I don't want to die, but I'd like to be injured enough so that I'd have to stop working for a while. Think about that. And she said, that's it, you're getting out of here. And he quit and left. And I'll end with a doctor, one of the doctors. I gave 110% for many years, only to find myself exhausted, bitter, and disillusioned. If I could do another profession with my medical degree, I would. I would advise my children to avoid medicine. Now, that's some serious stuff. I somehow remember that song, mamas, don't let your babies grow up to be cowboys. Well, this is don't let your babies grow up to be doctors, kind of thing. What is happening here? So burnout among healthcare professionals, hope you can all see that clearly. It's been at the forefront of work on burnout for a long time. When I got into this research, it was clearly something that was coming up and being talked about in what I will call more caregiving, human-oriented service kinds of occupations. And healthcare certainly is one of that. So it's linked to, and I'm just going to summarize, research done by many people, not just myself. As you mentioned before, poor quality of patient care, more medical errors, dysfunctional relationships with colleagues, greater risk of substance abuse, greater risk of depression and suicidal ideation, and stronger intention to leave the medical profession. Now, there are recent surveys that have been coming out which put this in really stark numbers. You may be familiar with some of it, that over half the doctors who are 50 years or older are saying they're going to quit and leave within 5 years. 30% of those who are in their 30s are saying, I'm going to quit and move on. One of the ones that really knocked me sort of for a loop, and in a sense, is related to the doctor that I happened to quote on that, and that was, there was a survey done of physicians throughout North America, and only 1 in 10 said they would recommend medicine as a career. Something is seriously going wrong here. I mean, how could medicine, this noble, wonderful profession that all of us, admire and need and, is doing such wonderful stuff, people are saying, I would not do it again. I would not go back. So in a sense, those are the kind of things that I worry more about, whether than, what is the rate of burnout per se. It's what might be linked to that as these other kinds of issues. So one of the things I want to talk about is how burnout is thought about and talked about, because sometimes it's not being presented in, I think, a very accurate way. It's often framed in an either-or kind of thing. And people say, is it about the people? Certain kind of personality types will burn out or something like that. They're just not meant for medicine. Or is it the situation and there's too much stress and stuff going on in the job? And it's or either or is the wrong way to look at this. But what it has meant is that more often than not, particularly in the United States, burnout is viewed as an individual weakness, an individual problem, an individual failing. If you are experiencing burnout of any kind, this exhaustion, this cynicism, this, why am I here, et cetera, must be your problem. Something's wrong with you. You better fix yourself, et cetera, et cetera. And there's probably a lot of reasons for that, which I've been sort of speculating on. But what it means is that when people then say, what do we do if we think we want to, it's a problem we need to deal with, all the solutions tend to focus on how do you fix the person. And there's not much attention paid to the other, which is what's going on around the person and what kind of situation are they working in. So what we really want is a different way of understanding it. Now, this quote that I put here, almost 1 in 2 physicians has symptoms of burnout, this is Tate Shanafelt and his colleagues at Mayo who have been doing a lot of the work. And what it's calling attention to is saying, you can't say that every single individual person is, if so many of them are having problems, that it's an individual failing. You've got to be looking at the situation. I want to add a little cautionary note here, because I've been seeing things saying half of physicians are fully burned out. Actually, if you look at the data, almost 1 in 2, yeah, that's getting close to 50%, has symptoms. 1 or more symptoms, which means they might only be exhausted, but not getting into that negative cynicism and so forth. So in a way, this is pointing out a problem, but it's overstating it, okay? It's not that half of them are all, at the very peak, negative experience of burnout. And I'll show you some data in a little bit that we'll kind of look at, that there's many sort of varieties of patterns that we see here that would be important. So I'm glad there's more attention. I'm a little saying, don't get too crazy about this, but, sort of look at that. Okay, so rather than either or, I want to argue for a both and kind of situation. It is both. It's the person. It is also the situation. And I'm not arguing against doing wellness things, resilience training, telling people all the things, get more sleep, be healthy, da-da-da, et cetera. I think that's fine, it's good. What I am arguing is that you have to look at the environment as well. And it's not sufficient to sort of say to people, go off and make yourself stronger and better, and that will be the end of it. I've used a little matchbook there as a way this was on the first article I ever wrote about burnout. I could not get my original data published in a journal because they said, oh, people don't burn. Come on, there's only a few that might. No, that's not a real phenomenon. Or it was qualitative, it wasn't, laboratory stuff, all this kind of thing. So I published it in a magazine, and that was the cover of the magazine. And I probably got more response to that article from people everywhere because I read that magazine. And this was, they had this matchbook. As I think I mentioned to some of you that I've met earlier today, when I was doing the interviews with people and learning about this, I didn't know about burnout. I sort of stumbled on it by accident. That sometimes people would draw me pictures or cartoons of what they were experiencing, as well as trying to say in words what they were going through. And one of these, which I probably should bring in to show to you, is, because it's very kind of cute, it was a guy in a white lab coat on a treadmill, running really fast with a big fire and flames right licking at his heels, okay? So if you say you got to fix the person, you're going to make that person able to run faster, run longer, recover better from running, but you're not touching the fire that is driving him or turning down the treadmill to be at a little bit more walking pace maybe or something like that. So that's really kind of the plea that I want to make, that we need to really rethink what the problem is, what the solutions in the process of improvement here. I think sometimes that one of the downsides of having someone like me as a psychology person, researcher, being the one who is presenting data on this, makes people feel that it must be a psychological deficit or a psychological illness or a mental illness. And therefore, we're always looking at the individual. I think there's more than that. But what I want to say is It's the person I'm a social psychologist, and I also care about what's happening around people. And the data that we've gathered really says, don't neglect that. That really is critical. Okay, so to rethink the problem, it's not an illness. It's not, a chronic, although people keep saying that. The New York Times did an article last year, and that's what they said. But it is an experience that people can have in response to chronic stressors. Chronic stressors mean these are the things that are part of your daily life. You have them all or most of the time. They are not the acute crises that we all, rally and try and deal with and solve. It's this other stuff that's just wearing away. People talk about erosion of my soul. It's kind of like after a while, you're just not keeping up with it anymore. What happened? So what we see there is in that experience is three components. One is the exhaustion, and that's the stress response. It puts it in the stress arena. And the research shows that all of the physiological kind of things that are associated with exhaustion are here with burnout. You see the same kind of problems. But what, for me, is the important bottom line with burnout is this next one, this cynicism, or sometimes this depersonalization, as I used to call it when we did my earlier interviews. And this is this negative, cynical, hostile response to the job, to the other people. It's, as I said, there's a country western song, take this job and shove it. And that's kind of, and it's kind of like you don't want to show up, you want to come late, leave early. You are minimizing your time with whatever the parts of the job you really dislike, the most. For me, the important bottom line here is that what we find is people start shifting how they do their job. And instead of trying to do your very best, you're shifting over to doing the bare minimum. You're still getting a job done, but it's not as good, it's not as complete. It's what do I have to do to make sure I get through here? But what am I not doing? I'm not following up, extra things I could do, etc. And then the inefficacy, and this is really a negative response to self. This hasn't been looked at as much, unfortunately, but it's beginning at some point. It comes in later, usually. People start off good and positive, and then this erosion is kind of going on. And then later beginning to think, maybe this is a mistake. Maybe I shouldn't be here. I'm not proud of what I've done. I'm not sure I'm doing this well. Maybe this is bad. We do know from research, longitudinal research done by colleagues of mine in other countries who can do this, track, the entire population of Finland over 10 years, and see what they're doing. That burnout is a step towards depression. It is not depression itself. When you have someone with severe clinical depression, anxiety, you've got some other problems there. But I think sometimes people think, well, if it's leading to depression, maybe we just consider it depression, and then we send people off and get therapy for burnout. And it's actually, we're not seeing that that's the best way to go. Okay, so what is it not? It's not only one of those three dimensions. There are a number of researchers who only look at exhaustion and call it burnout. Well, exhaustion was a perfectly good name. There's a lot of, no need to change it. And I'll show you later, exhaustion alone looks different. It is not a disease clinical deficit, but a step in the path. The other thing is everybody's looking for if you're thinking of it as a medical illness or, deficiency, you're looking for a single score that will tell you you're burned out, or like you have a fever, or you don't. There is no such thing, okay? And no clinical research has ever established that there's a particular number or something like that. It's also used to mean a lot of other things. People think that, I've burned out, I haven't had a new idea in, 2 years or something. People use it as a sign of boredom, laziness, workaholism. Actually, those are different kinds of things. So, at any rate, I'll get to this a little bit later also. But at any rate, the idea that it becomes a disease and it can be diagnosed, people then are thinking of treatment in a sense of an illness or something. And we're not finding that that's the solution. The other thing that has been done, certainly in other countries, not all but some, if they decide that someone is burned out, they remove them from the job. And that's, it's sort of you're off for several months, something like that. Not clear that that makes a huge difference either. So my argument is really burnout at some level is a signal. It's like a little red flame actually coming up saying, things are not going well here. There is not a good thing going on between people and the workplace. And it's a sign of, let's figure out what those things are. So, burnout is not the end point that we should really be focusing on, but it's telling you there's a warning, there's something happening. So measurement issues. You mentioned that there's the Maslach burnout inventory. This was the first measure of burnout that was developed several decades ago by myself and my graduate student, Susan Jackson. It was based on a lot of interviews, data. We talked to people, we talked to their spouses or family members, we talked to their bosses, the people who were supervised. We collected a lot of data to validate that the items are measuring what it is that people are feeling and what they're doing. Many of the other measures that have been developed since then are shorter. They only measure exhaustion because people don't like having 3 things, they want 1. And they've changed the response format and scoring. And so different measures mean you can't exactly compare one to the other. And some have not been validated. The way they've been validated is that they correlate highly with the Maslach burnout inventory. But they haven't actually checked to see what the items are measuring. So I just mentioned that because it makes the field a little messy in that case. But I can understand why people want shorter measures. In fact, it's Schanefeld and his colleagues at Mayo have been collecting data like on thousands and thousands of medical students. And when you have that huge a sample, you can say, what is the best one single item out of that whole thing that will measure burnout? And you know what it is? I experienced burnout in the workplace. You don't need a measure to tell you that. I mean, and that's it, and that's the way it should be. That item should be the best item on the measure because that's what it's supposed to be all about. But what I'm saying is this is not something that is a mystery and people have not a clue what's going on. So as a self-diagnosis, I'm not recommending this. This is a research measure. What kinds of things are linked as sources of burnout? What kinds of things are outcomes of burnout? How do we understand the phenomenon? So it was not meant to be a diagnostic tool, but it's used that way. Respondents may not give true answers. And I want to mention this particularly here because I probably get more emails from people like medical students or residents or something in healthcare saying something like, I have to fill out your measure every year. And I say, oh, really? And here's why I don't like this, kind of thing. And say, okay, tell me about it. One is basically they're saying, I lie about it because I know if I really say what I'm thinking and feeling on this, because I've seen it happen to other people, I will be tapped on the shoulder by somebody, which means it's not confidential. It's not anonymous. They know who I am and where I am. And they'll tap me on the shoulder and say, you're showing a problem of burnout. You better go see a counselor or a therapist and get fixed up. And it's kind of like saying, even if I felt like I wanted to talk to a counselor or therapist, which I don't have the time because I have all this other stuff to do. And there's not, plus it's going to maybe hold me back. I'm not going to get the same kind of opportunities. I'm not going to get the same recommendation. No way I'm going to, because it's viewed as a personal weakness, personal failing. So what that means is I don't know how trustworthy some of this data will be. So I, again, caution on that. So anyway, I think I sort of mentioned it. It could be an inaccurate statement. People want something simple. Yes, no, you're burned out, you're not. And actually the whole thing is a continuum, and that's what allows us to do the research, actually. So, we have this sort of diagnostic versus research kind of challenge all the way through here. Okay, how many healthcare workers are burned out? I'm showing you data from a sample that some of my colleagues have put together. It's over 20,000 people in healthcare. And this is just on the exhaustion dimension of the MBI, but you see the same kind of thing on the other two dimensions as well, which is that it's a skewed distribution. It's not normally distributed. It's skewed toward the lower end, meaning, in this case, what we ask is not, do you agree or disagree with this item? We ask, how often are you feeling this? 0 is never. I'm never feeling exhausted. But you get around 1 a couple times a year. You get to 2 about once a month, okay? So we're really getting a sense of, how often does this come up? So the critical group, you'd probably think just on that basis alone, would be people scoring 5 several times a week or 6 every day. This is how I'm feeling. And this turns out to be somewhere around the 10% of a population that is scoring that extremely high. But the question also is, if there are people who are high on exhaustion, saying I'm exhausted most of the time during the week and every day, how are they looking on the other two dimensions of burnout? And what we've been finding with recent data of healthcare professionals is that there are actually 5 profiles. It's not an either or, yes, no. And let me show you a little bit what that's like. Okay, so what we've been defining as burnout, a really true burnout experience, is 3 high negative scores: exhaustion, cynicism, not feeling, doing well on the job. There's another pattern, which we're at the moment calling disengaged. The only high negative score you have is on that cynicism. Exhaustion's not so much of a problem, either is the other. There's another one we call overextended, and that's the one, exhaustion is high, nothing else. Okay, so they've got one of them. Third one is what we're calling ineffective, and that's the, you're not exhausted, not cynical, but you're not really feeling so good about yourself in this job. That one gets really understudied. And engagement, no negative scores. All 3 are positive. You're not having a problem on any of those, okay? So we are getting, when we look at this, look at a different way of using the scores in the research, we're finding that we have at least of these 5 profiles. Here's another way of presenting that data. It was based on, we had 2 samples of about 4,000 each. And you can see in there that they cluster in, these different clusters. The red down at the bottom, we probably should have changed the color, is the engagement group. The burnout are the blue ones on the far end. The overextended, high on exhaustion, and you can see with the yellow with the disengaged on the cynicism and so forth. So here's another way of putting that. And again, these are all people in healthcare. So if you look at that, you see 29%, that's roughly a third of the sample saying, I'm okay, no problem, I'm not experiencing any of burnout. I'm, engaged, no exhaustion, da-da-da-da. All the rest of it has at least 1 score on burnout, and they're scoring high. But the one that is where all 3 are high, that what we've really defined as burnout, is, as you can see in that blue one, turquoise one on the top. In this sample, it was 15%. But then we have 20% who were saying they were disengaged. They're cynical, that's high on that. Overextended, that's the high exhaustion group. Ineffective, the 20%. So if you add up all the ones that have at least 1 symptom, you get 70% in this particular sample. So you see what I'm saying about only looking at 1 as opposed to all 3 on that. So 6 strategic areas. What we have found in the research, and when I say we, I mean lots of other people, not just myself. And basically what we have found that if there is some mismatch, some imbalance with it between the person and the job in at least one of these 6 areas, it predicts burnout. And the article that was cited in my introduction, Journal of Applied Psychology, tracked people over a year, and that was what it was showing. You know, what we saw at time 1 could predict burnout at time 2 a year later. Okay, these are not in order of importance. These are in probably the order that people think about them and in the order in which there's been research done on them. So workload. This is the demands, okay? So when we're talking about a mismatch here, it's like you have way too much to do, not enough resources to do it, not enough time to get it done or do it well. You know, it's really hard, you know, to do that. So that's those kind of demands of the workload in the environment. Second one has to do with what is called control. This really is referring to autonomy, having some discretion, some choice as to how you carry out your work, using the skills you have and the thinking and in whatever to make some decisions, as opposed to being, you know, boxed in terms of what you can do. Third one we call reward, but what we are finding is this is positive feedback, okay? If you do something well, is there anything in the world there that kind of feeds back and says, yeah, good job, you know? What we are finding is that it's not so much about actual material rewards. Salary is not as big an issue as we would have thought. Benefits, not as big an issue as we might have thought. Recognition from other people is a biggie. Could be your colleagues, could be your boss, could be your patient or a patient's family. It could be all kinds of things, but it's the kind of thing of, you know, and you are letting other people know, oh God, thank you so much for doing X because it really made a difference. Community refers to the workplace community. So this means the people you deal with on a regular basis, your colleagues, people you supervise, people who supervise you, patients, could be vendor, I mean, whoever it is that you're in some sense, you know, you engage. And are those relationships working well in terms of trust and support and recognition and help? Do you have some good team spirit to sort of working well together? Or, as I quoted one other worker, not healthcare, socially toxic workplace, where people are throwing each other under the bus, there's unfair competition, there is, you know, all kinds of things that are making it difficult to work. Fairness. This is really referring to any kind of policy, procedures, you know, practices that we do. Are they fair and are they administered fairly? If people feel they are being treated unfairly, being passed over, not getting opportunities that they probably, you know, at some point should expect might come their way, get a special assignment that, you know, is a little more interesting or challenging. This breeds a lot of the deep cynicism that somehow this is not a good system, you know, to work in. And then the last one, which has less research, but sometimes the most critical, is values. And this is really about meaning and purpose, and why we're here, and the passion we have for the kind of work that we do. And if there are things, ethical issues, or ways in which we're not practicing what we preach, if there are some things that essentially, as people talk about the erosion of my soul, I don't know why I'm here anymore. This was not why I went into healthcare. Something has gone wrong. And so it's these 6 areas that we've identified so far as being highly predictive of whether burnout will occur later on or develop. People have asked, do all 6 have to be in good shape? No. I've seen a lot of people where they're not getting paid well, they're, you know, they got crappy conditions and all that kind of stuff, but values is so strong in terms of the job they're doing for others that carries them through. I have seen other people where everything is wonderful in the first 5 and values is the killer. And it's, you know, say, I can't, paid well, great place, but I can't do this. So we're still trying to figure out, are there important patterns? Are some of these more important than others? At the very minimum, I would say that this becomes a potential diagnostic tool to say, where might we start looking for ways to improve things? Where, you know, because some of these things might be in great shape and others are going to be in bad shape. What could we do? And I'll show you an example of that a little later. So when you look at those 6 areas in terms of the mismatch, what are you seeing? You're seeing the demand overload. Burnout, by the way, is not about a mismatch in terms of boredom, not enough to do, and you're playing card games on your computer because there's nothing, No, it's the overload. A lack of control, autonomy in terms of what you do, insufficient reward. I think I mentioned to some of you earlier that when I was interviewing people about these things, and sometimes one of my questions was, can you describe a good day? What's a good day for you in your work? And when people say something like, nothing bad happened, and that's the peak experience, it's kind of like an absence of bad stuff is the best I can expect, as opposed to there's some good things, that are happening. And I must say a lot of caregiving, human service kind of professions, probably not intentionally, but are constructed and designed in such a way that, as many people said, my successes go away and my failures keep coming back to haunt me. And so I'm not, if something works, they're gone. We don't even have a chance to chat or there to say, oh, thank God you were there. It really helped my family, whatever. So again, the situation is critical here. Breakdown of community. Where you have, conflict, unresolved conflict, no ways of figuring out how to agree when we disagree and move forward, lack of trust, lack of social support, all of this kind of thing. Much research in psychology says that one of the most important things we need, all of us need, for good well-being, mental health, et cetera, is other people at home, in the community, on the job. And having those that social network, those relationships of people you can trust, have your back, you have theirs, et cetera, is as I've been saying, it's like money in the bank. So, when this breaks down, critical resource gets lost. An absence of fairness, this is something, as I said, can really drive people crazy, and value conflicts. What I can say is that the more there are mismatches, probably you're going to be more at risk for burnout. But as I said, we still don't know if there are some that carry more weight than others. Okay, so back to this graph here of these different 5 profiles. One of the things we looked at there was, how did people score on those 6 areas? What does it look like? And it looks like that. And if you look at it, you can see on the left, that's the engaged group. They are scoring positive on everything. They're not showing burnout at all. And everything on those 6 areas, and we added in some other questions, my colleague working in administration, it's all positive. It's above the norm. They're doing better, than the average. So you move along, and you see on the opposite end, burned out, all 3 negative. And they are looking pretty bad. They are really below the norm on all of this, and negative kind of thing. Okay, so in between, we have 3 other groups. The ineffective group, next to engaged, these are the people who are not exhausted, not having a problem with cynicism, but they are really feeling not effective in their work. It's almost, I get this picture almost of sort of this quiet desperation, like nobody. What we find, actually, in looking at some of their answers, is that if you look at the reward recognition one, it's the lowest, and they often feel like they are unappreciated, not recognized, nobody knows what they're doing, they're contributing, but it's kind of like, nothing more is happening here. There's nowhere to go, there's, et cetera. As I said, they are understudied, and so we need to use a lot more research to find out. In the middle is the overextended group. And as you can see, their big negative issue is workload. It's a really strong link. If you have mismatches in workload, demands, et cetera, exhaustion is going to go up. It's pretty clear. And I want to point this out because look at the next one as well, disengage. They're not having exhaustion issues. Okay, workload issues, sorry. They don't have exhaustion either, but no workload issues, but everything else is beginning to go sour and going south on this. they look much more like a full, complete burnout experience than the overextended, exhausted group. But the problem or the challenge is that a lot of research, some researchers are simplifying everything so burnout is only exhaustion. And if you're defining it as only exhaustion, you're really, the overextended is, maybe sort of on that way, but it's not looking a lot like burnout. So they really aren't the same thing in terms of their experience of what's happening in the workplace. So rethinking the solutions. The problems with focusing on the individual only. And again, I'm not trying to say healthy stuff is bad. No, I think it's good. But what happens, what we find a lot is that it's blaming the victim. If you are having any problems dealing with these chronic stressors, the common response is to say, it's your problem. There must be something wrong with you. And implicitly, they're saying, you just have to suck it up. So the workplace is stressful. Welcome to the real world. That's it. You just have to adjust. I think we're giving bad workplaces a free pass, and we should not be doing that. They not only are stressful and causing problems, they are exploitative. They're not good things, and we should not be doing this. The other thing about the individual solutions is all of them are helping people cope with the situation as it is. Not a bad thing. But it's not trying, as I said before, do something about the fire, that's looking at your heels. It's not trying to say, could we improve that situation a bit, make it a little bit healthier place so people can thrive? And as I said, giving them a free pass, even though the research data comes down very strongly and consistently from many places in many countries, many occupations, that the sources are much more of these chronic stressors in the workplace. Like of the 6 areas that I mentioned. Another thing is that when I'm asked about doing research and it would be like, okay, what we're going to do is we want to, measure burnout and we want to lower those scores. And I know I am the author of a measure and you would think, oh, yes, of course, and use my measure, why, et cetera. That's not the question to ask. People call me up and say, we took your measure and we got these scores. Now what? And I'm saying, did you measure anything else? Did you look at what you thought might be problems? Did you look at anything? I can't tell you. All I can tell you is you've got a normal distribution. That doesn't tell you much. So the thing about burnout, as I said, it's a warning sign. It's not the important endpoint. The endpoint of those outcomes of burnout that you think are linked to burnout, that you want to change, those should be assessed. Those should be defined. What we are finding is that burnout is a lagging score rather than a leading one. It's when other things change that burnout will start to move. So to say, let's move burnout somehow, and then everything will get better, is really not the way to go. It will not get better until you start working on what might be the important things to start with and get better. And that is really this question of what will success look like. And I want to say that because it's not like you know absolutely what success will look like. But too often I have gone to the organizations and talked with people and they've said, we want to do something for people here and really help out and make it better and reduce burnout. And I'll say, okay, and then things will be better. And I'm saying, and what will be better? And there's this silence often, kind of like they haven't thought that. They just figure it'll be better. And I'm thinking, well, that people, you won't have so much absenteeism? Is that what you mean is going to be better? You won't have so many errors or complaints? I mean, what are you whistling while you work? I mean, what are the things that will be the sign to you that we're better and we're doing it? And it's not going to be lower scores on burnout, but you have to think past that and sort of say, how will we know that we're actually on the right path? How will we know that we're making progress on this? And so that we can track it, we can go back to it, we can tweak it when we need to, and so forth. So burnout is not the end point. It's a signal, it's a warning sign. It will point you to those 6 areas and stuff, but then you have to think, what will, for us, be the outcomes that we want to see? And then finally, I would say a more systemic framework. Again, not an individual problem. I think what we don't do too often is actually define this in terms of units or departments. And that's usually how we do everything else in a larger organization. So it's not just about individual people, it's like the whole team, everybody who's whatever. And if you think of safety measures that we put in, we don't go individually, person by person necessarily, but we do think about, what is safety going on in this department. So in a sense, burnout is really this mediator. It's in between the job mismatches out there in the work environment and the outcomes that and I've put a few of those over there. And so it's the sign that there's, things aren't working as well. But in and of itself, it's not a disease, okay? It's telling you something, but you need to work on other things. Okay, so another way of thinking about it is framing it not in terms of how do we lower burnout, get rid of burnout, treat burnout, but let's pivot from the negative to the positive and say, where do we want to go? What will better, healthier, successful workplace look like? Well, if you take those 6 areas as a start, what might that look like? And here's some possibilities. We're talking about a sustainable workload. There will be some tough days, there will be some other days, but something that is possible for people to keep moving and doing it and figuring out how to do it. That there is some element of choice and control over how they do the job so that they can maximize, the good outcomes that they're, capable of achieving. Making sure there's, recognition going on. And this can be informal. It doesn't have to be things like gold stars, on a wall or something, but how we treat each other and whatever on this. A supportive work community. How do we build, relationships with people that we really get to know each other, we have that trust, we come to each other's aid, we help each other out. It should not be the case that you are afraid to talk to somebody and say, I'm not sure how to do this, or expose you're not completely on top of things, or even that you're feeling bad, and you need a helpful kind of person to just sort of, talk with. That should be possible in a healthy workplace. That there is fairness, there is respect, there is sort of social justice, how we do things, we're clear about what we stand for and how we do it, and, walk that talk. And that there are clear values and meaningful work. So one of the things to sort of be thinking about is, as we look at those 6 areas, not just where there may be problems, but what might be some of the things that would get us closer to these kinds of more positive goals. And this is just a first pass at doing those 6 areas. There may be other ways of thinking about them, but in some sense, I think that's really more the direction of thinking about interventions, solutions, some things that will make a difference. And that better strategies, and this is true when we look at the research on that, focus on both the person and the situation. So it's not just one or the other. So part of it is building engagement, focusing to the positive and how do we support that. Doing regular assessments. This is like checkups. And you as a health group probably understand this better than other people. Often, assessments come in because there's been a crisis in the organization, and now we're going to survey everybody, and we're going to get all this kind of stuff. Well, that's a bad time to actually do some work on figuring out what needs fixing. You want to do it when people are okay and just normal, healthy, moving along, maybe not so healthy, but we go in for a checkup to see how we're doing, How is your blood pressure, about your weight? I had a checkup just before I came to Houston last year, and everything was fine, except that my eye doctor said, you better get those cataracts out so you can see better. And lo and behold, I now see 20/20. It's fabulous. But it's a checkup where, you're not going because there's a crisis. You're not going in because, you broke your leg or, some sort of thing like that. You're going in just to check and see how things are going and what things are going well. Great, talk about that, but also where could we do some improvement? So the checkup doesn't say what you have to do as a result of it, but it's a marker, sort of saying where we are. So doing assessments where you're doing it not because there's a crisis or there's something wrong, but just to see how are we doing, because it gives you the possibility of early detection and prevention, which ultimately I think is what we want to do when we talk about burnout. So actually, I've done some organizational checkups. These are large organizations, many employees in different levels, and we worked really hard in this research to make sure we were getting as close to everybody as we could. I don't know if you've ever looked at survey research, but they'll send out things to everybody and feel, wow, successful, we got 16% of them answered. Well, if you get 16, 17%, less than 20, you don't know who's answered. You don't know that they're representative. You don't really, it could be the people who always will complain the most who are going to fill it out, or the ones, who know. Any rate, we work really hard to get a process going where we are getting 80 to 90% of the employees answering. And it's a shared thing in terms of the stuff going back to everybody. It's a collaborative planning process. To do that, you really have to do a lot of stuff to get people to agree to be on board, to try it out, to get feedback on this, et cetera. In these checkups, then there would be, as a result of that first assessment, there would be some decisions made about what they were going to do in the workplace, and then we came back in as researchers and did a second checkup a year later. So let me give you an example from the very first one we ever did. It's not a healthcare organization, however. And what I'm showing you is at time one, this was about 1,000 people in the organization. As I said, most everybody. And we looked at what their average scores were on those 6 areas, the measure that we had of those 6 areas. And it's on a baseline of what is the average. So if it's above, they're doing better or slightly better than the average for those kinds of occupations. If it's lower, they are doing worse than what is the norm, the average on this. So this is what happened to this organization. And when I had asked them ahead of time, I said, what do you think is going to be the problem here, or problems? And they said, oh my God, everybody complains about workload. It's going to be workload. And they're always complaining about salary. So I get the rewards is going to be, in the pits. Interesting. You did an assessment. It was not workload. It was not rewards or recognition. But I have to say the administrators were shocked by the low values on fairness and values and saying, you mean people think we are an unfair place to work? I mean, how could they, what? Kind of thing. I say, apparently so. And so what the decision was by the CEO was to take fairness. He wasn't quite sure how to get his head around values. So it's fairness. And he said, okay, we are going to work on this. And we're going to find out what are the things that people think are unfair, and we're going to see what we can do to change that and somehow improve those things. A lot of the employees, because all of this was shared, as an overall thing, we also broke it down by department so that different units could look at their own profiles, but we just shared the overall. And the reaction was to the CEO, fix it. And he had, I think, the wisdom to say, I need you to help fix this and tell me what you think is going to be fair. So everybody, so they set up committees and work groups and stuff like this and worked on a number of issues. A year later, the pink bars are showing you how people scored on the 6 areas. Now, if you look at fairness, there was a real shift. They really made a change from a negative, more negative scores than the average for those occupations to a very positive one. So it was like, yeah, we could make a difference. And now people are beginning to say, it's better, we got some fair procedures. The other thing you might notice, and this is not uncommon, is that all 6 of those areas showed a bump up. And it's because they're interrelated. They're not independent. So, people were feeling better about, the control they had over it. They were participating in these efforts to try and improve the workplace. They were feeling stronger about, less negative about community because they were getting to meet people and work together. I mean, there were a number of things that were sort of, related benefits on this. Now, let me tell you just a little bit about what an example might be of fairness. The one that really stood out for me was that they did multiple things. Different units were working on different things. But the one that was really department-wide, or organizational-wide, I should say, was a an award, a Distinguished Service Award, which is given to people who have done something exceptional. They've gone above and beyond, done something really special, not just, doing a good job and everything, but something really different. And it came with a hefty little check of money, so there was a nice thing going. However, what I was learning from all the data from the people there was it was universally hated. People hated this award. If they got nominated, they didn't want anybody to know. And I'm thinking, this is not qualifying as an award, because, this is what is going on here. And so when I brought this to the attention of the CEO, this is one of the unfair things, he said, oh, well, maybe the money isn't enough. Maybe we should make it a little richer, a bigger check, And I was saying, reward is not your problem. Fairness is. And what people are saying is, this award sucks because it is so unfair how the process works to give people this award. And there are multiple ways. I'll just give you a few. You had to be nominated by your supervisors, the first step. Well, for some people, the supervisor never goes in and nominates anybody for anything because it's an extra job and they don't want to bother with it. So sometimes you're just shut out because that won't happen. Or it's unfair because the supervisor will try and get a pay raise for somebody, couldn't get it, and said, never mind, I'll give you the Distinguished Service Award instead. No, you're changing that. Or one that got a lot of ire is that it would be a whole team that had done this exceptional thing. Who got the award? The leader of the team. And sometimes the leader was not the one who got the job done. So there was this sense of this is not, always a fair kind of process, and many others. But at any rate, they worked on designing a new kind of distinguished award process. And it took a while because people realized this is not easy. You put in these things, makes sense, ask the supervisor to nominate. What could go wrong? Trying to do a better job. And they put it in place. And they actually got a different kind of award thing before they took, the thing a year later. And people were really pleased. It's kind of like, we could make a difference here. We got a better system. Now it's okay. Let's, et cetera. Anyway, so those are the kinds of things that could make that kind of difference. But the other thing about it, it was a collaborative process and got people in, so that there was input. People had a lot of ideas. Some of those ideas didn't pan out. People didn't go for, but at least, they had a process for doing it. Okay, so building engagement, that's another strategy here. Work engagement is what we've talked about as that positive opposite. So, you've got a lot of energy and enthusiasm. You are more wanting to be involved in the work. You really love doing what you're doing. You're feeling good about what you're able to accomplish. And hopefully that's what's happening on a regular basis. And what I'm finding is that efforts to achieve a positive goal, if you frame it, again, if you do this pivot away from burnout to engagement and say, let's think about how we can make this place more like we would like it to be, as opposed to what do we do to stamp out burnout. You'll get a lot more volunteers working on how to improve. And it's a more, and if you could make a first difference, a first improvement going on to a second one, people are saying, wow, we could do this. We just did it on the Distinguished Service Award. We could do this again. Okay, this is a different one. This is one where we're taking the community area. And again, I've mentioned this to a couple of you during the day-to-day. And this is a colleague of mine in Canada who worked with a number of different hospitals, primarily with nurses, because they were the ones who said they would participate. Not everybody else did. But at any rate, it's something that was developed within hospital settings by nurses, and it was tested there. We did not develop it, but it's civility, respect, engagement at work. It's a 6-month team process to really build a better supportive work community. And when I say 6 months, it lasted over 6 months, but it was an hour a week, carefully trying to find 1 hour where everybody in the unit could get together. Not easy, but that's what it meant, and did that for over 6 months. And when I talked with the nurses, about that, when I sort of went around the hospital looking at what was going on, the thing that drove most of them the most crazy, I said, what is the thing that really gets you about civility and respect and stuff like that? rolling the eyes. If you think about it, nonverbal, but when you roll your eyes at somebody and you're saying something, you are saying something else. You are saying, I don't think much of you and what you said. I don't believe it. That's stupid. Why do I have to put up? Well, all those kind of things could be read into it. So I was saying, well, you can't have a law about rolling eyes, but if you can build a better work community, you know, so they do this. They would point out people. At first, it was like identifying where do things, you know, not go well in terms of communication between people. How could we do it differently so that we're not constantly, you know, being snarky and rude and, you know, put downs and all the rest of it. My colleague was part of the research team who evaluated these at all the different hospitals and did the research to show the teams that had gone through this process versus those that hadn't yet, and clearly show results. The burnout rates drop, absenteeism rates drop 6 months after, a year later, a year and a half, more civility. And so it's something that takes time, and usually if it's anything important, it will take time because you have to kind of get out of your habit and into a better place and practice it until it's second nature. But I leave the workengagement.com/crew website there if you're at all interested in the kind of things that they do. But again, this is looking at a community issue, and it's the chronic stressor of interacting with people in ways that aren't really nice and helpful and supportive and so forth. And changing that chronic stressor into something better. Okay, when I've looked at how change occurs, there's a lot of different things that are qualities that stand out to me as what you have to have. And I say this because it's not enough, like I said before, to sort of say, well, we'll do something, and then we'll just wait and see, and it'll happen. It doesn't just happen. You have to actually plan it and work on it. So one of the first things I would say is, and I'm calling it urgency, but that the goal, whatever it is we're working on to try and improve and make better, people have to feel, yes, this is important. I'm willing to work on this. Can we do it by tomorrow? You know, it's the sense of it's meaningful. This is not just some, oh my God, this is the new flavor of the month of management, really? Do we have to change what we're doing? So there has to be something that people are willing to commit and do the work on the ground that will get you there. Targeted, that there's a clear target as to what it is we are trying to improve or change and why, and you know, what are the things that we can bring to bear to get there, so that there's real clarity about why we're doing what we're doing. I cannot tell you how many change processes I've been asked to come in and observe, and most people have not a clue why we're doing this. Don't we already have a system for accounting? What is this that's going to happen? Now, it may be a great reason to do it, but they haven't been, it's not clear, and it's going to disrupt, you know, because you got to get used to the new one. The old one is better. Okay, oops. Why is this not moving forward? Oh, there it goes. Okay, collaborative. This has to have, you know, if these changes, whatever, if it's system-wide or if it's in particular unit, you know, like in that unit, it's got to be that there's some continuous employee participation at all sort of levels and ranks. All the people who are going to be involved in actually doing this stuff, carrying it out, making it work, making it happen. And I cannot emphasize that enough. Is, you know, if it's changing a toxic, socially toxic environment, you got your hands full because you need this, you know, for this kind of thing. But it is really critical, like the people changing the award that recognized special stuff. They had to think that was important and that they would work together and they'd figure out a better solution. Successful change processes have to be sustained, and there's an ongoing commitment over time. And it means that there's going to be an agenda item every few months saying, so, how are things going now? How are we doing now? Do we need to keep at this? So it's on the radar. It doesn't like, okay, we're doing a change, 2 months later, we're done, move. You know, no, this has to be important enough that there is this ongoing commitment. And then the last thing we see in successful change is that it gets evaluated. And there's a lot of research on solutions for burnout, for stress, and stuff like that. And a lot of it is not very good research, and the reason is, and there's reasons why, it's expensive, it's difficult, not everybody participates, et cetera, but often there's no evaluation at the end. It's like, okay, we did it. We had a whole bunch of workshops. We had these all-day seminars, and it's kind of like, okay, and then what? What? What did you expect to happen? What would success look like? If people went through these workshop seminars, what are you expecting would happen, at work when they came back the next week? And it wasn't clear, and it wasn't evaluated. And so it's like, if people ask me, was that a good thing to do? I have no idea. It could have been wonderful. It might have been not worth the time and effort. But, there's no kind of evidence that sort of says, this was worth our time, effort, money, et cetera, et cetera. You want to know that you're investing with a good return on that investment. And the only way you're going to find out is you figure out, what do we need to look at that will tell us we're on the right track? Or do we need to tweak this in some way? So I mention this because change is not an easy process. Even if people are complaining about something and you say, okay, let's make a change, some of those people will want to not change because it gets messy, it gets disrupted, and they're saying, at least I knew the old thing, I'm comfortable with that, and we're moving into uncharted territory. So really thinking about these qualities and figuring out how you're dealing with it is going to be important to make it actually work successfully. It can be a great idea, wonderful suggestions, but if it doesn't get implemented well and evaluated, who knows? You may have lost an opportunity on that. Okay, so some conclusions here. It's more of a chronic situational process than it is an individual problem. And if you think of it more in those terms, you're going to have a different way of trying to approach it. Improvements in the social work environments can help prevent burnout and build engagement. There's much less research done on changes in social work environments than there is research on individual training, yoga, mindfulness, all those kind of things. But when they're there, they're more likely to show some effects than some of the others. It's more mixed. Sometimes they work, sometimes they don't on the individual level. And I have a feeling it's how they're implemented. Social improvements rely on reciprocal relationships between people. So this is why, again, that community area and the social relationships is such an important thing. Not only do you want to feel that you're being supported by other people and you have people you can count on if you need, some advice or whatever, you've got to be that person for other people. I mean, it's your job as well to mentor somebody who is new and coming in, to you see a problem, somebody really having a bad day, to kind of check in and say, how are things going? Hey, you want to get a cup of coffee or something? Let's, whatever. So it's like we have to not just be role models, but remember, all of the ways in which other people have, in big ways and small ways, helped us move forward. And at some point, you've got to be concerned about the people coming behind you and play that role and do that. And we're just finding that is such a valuable resource that I just want to emphasize it a lot. And as I've said before, those 6 areas of job person fit can be a valuable diagnostic tool. And you can use it in that way. I did talk to an earlier group this afternoon about a graduate student in the physical sciences at Berkeley who came to me after I gave a talk, much like this, on burnout. And I'm asked to address the graduate students every 4 years or so about career issues and, burnout and et cetera, et cetera. And I just did it last year. And this woman came up and she said, Dr. Maslach, I heard you 4 years ago. And I was, I had come to Berkeley and I was thinking this is the, the area I really wanted to work in this, in this science, particular science. And I was having a terrible time, a terrible year. And I was thinking, I'm not really, really good at this. I'm probably not fit for this job, and I'm, having trouble, and I guess I'm not so smart, and, really blaming myself. I'm not, it's not working, I should quit. And I heard your talk, and you mentioned those 6 areas. And I said, yeah. And I was going, the lab I'm working in, workload, issue, problem, check. Control issues, check. Recognition, oh boy, check. And went through the whole 6, and all of a sudden, I'm in the wrong lab. I've got to move into a better place and see if, it'll turn around. And I did, and it took time, and it was hard because you have to quit one lab and get into another. It's not easy to make that thing. But I found a different lab, and it's been great. And now I've got publications on the research we've been doing. I now have 2 job offers. And it was like, it wasn't me being, unfit for this job, but clearly I was in the wrong place in terms of, what I was doing. And I just wanted to let you know that those 6 things pointed out to me that I should look for a different kind of, environment to work in. So that's just a little example, and she doesn't need a measure of those 6 areas. It is intuitive in some sense what those 6 areas are about. But she kind of recognized what was going wrong in terms of her experience. So my sense is that's a tool, could be one of many, to help sort of say, where might we begin? As you can see with that case study I showed you on the fairness, if you start somewhere on something that people, this is one of the real irritations, is that stupid award, kind of the money going to the wrong people and let's fix it. There's going to be optimism later. When we followed up, people were saying, I have another idea about this thing over here that we could do a better job with, because there's a sense in which it's possible to make a tweak, to change the thing, et cetera. And that's what you want to build on. You want to get people giving ideas, input, to make it a kind of place where truly all of us can thrive. And so it's not just about us as individual people, what we bring to it. It has a lot to do with the environment in which we work. And we are affected by that environment, but also are the people who create that environment. So part of it is, what are we doing to each other, or how are we structuring these different kind of things? And it's possible, I think, to make it a place where people will be thriving, where there's going to be greater engagement and growth, among everybody working, doing the good things that they really believed in and why they are here in the first place. And we never, never, never want to lose that kind of passion and purpose and contribution to making our world a better place. Thank you.
Questions?
Sure.
Thank you very much, Dr. Maslach. Great talk. I think it's going to get us all started. Some great ideas. We have time for a few questions. Is there questions from the audience?
They're all questioned out because I had the earlier meetings, right? Oh, there's one. Yes, yes.
In your research, did you find anything?
Good. Yeah.
Did you find anything in their personal lives that affected things in the workplace? You speak about things that happened in the workplace specifically, but with the people that were having more of the severe problems, did they have things that were going on outside of work that helped contribute to that?
Okay, so everybody could hear that question about personal things. Yeah, there's two-way streets there. I mean, you can't completely wall off your work from the rest of your life. And so, yeah, there are reciprocal kind of things that can happen. What we were finding, and I didn't really mention, is that we were often seeing effects going from the job experience to the home life. And so when we talked with family members, for example, and spouses, and said, okay, tell me how he is or she is, at home, and kind of, what's going on with the family, and da-da-da-da-da-da. And it was, and looking at the ones people, who had really higher scores on all three of those burnout dimensions than those that didn't, you could see a really pretty clear relationship. And there were a number of things that would happen. I mean, sometimes it would be a overload spillover effect on the family life. It could also be cutting out the family or friends and just sort of, I am my job, and all I do, and I'm not there. And if I'm at home, I'm a couch potato, and I don't want to do anything, and I don't want to, be there. Or what we were finding is, people coming home saying, "Don't talk to me," don't want to, kind of thing. But also sometimes just if, they're more easily losing their temper, get more angry. They relive what they went through on the job until finally says, "Do not tell me one more time about your colleague who always gets you, I don't want to hear about it anymore," that kind of thing. So there's that kind of dumping. But I have to say, in a number of professions, and some of them were the ones where we think, wow, this is some really the most noble kind of work this person is doing, and that includes healthcare, but it also included families of ministers, for example. And what you would hear from the kids is something like this. It was usually my dad, but it could have been my mom. But, my dad is a great guy. He's doing all this great stuff in the community. He's there for people. Something happens, da-da-da-da-da. He's never there for me. And so there's a sense in which the family life, in this case, is getting sacrificed to everything that has to take place in that. Or I was talking to somebody else about, the job and the stress and whatever, and he said, I just tell my wife, don't ask me about my work. I don't want to talk about it. I don't want to relive it. I don't want to whatever. That's not the overload type. This is, wall. Really keep them very, very, very separate. Okay. But I know also what we were getting is that things that, it's hard to say chicken, egg, cause, effect on all of this. There could be things that are difficult to deal with at home, and work becomes almost a respite because you're getting away from some of this stuff. So it's definitely a two-way kind of street. But what I was looking for was getting a better sense of if the work had an impact, what was it like? What were the good things? I didn't just ask about burnout. It was also about the great things and stuff. But you would get those kind of answers. Yeah, this is really good what he's doing, but I'm not part of it, And I, so, and this would also happen with like friends. What I'm hearing a lot from young tech people is that the overload and all that kind of stuff means they don't have another life outside of that. And like their girlfriend or boyfriend is saying, what? You never talk to me, we never see each other, we don't do anything, you just kind of leave me alone, blah, kind of thing. And feeling, how do I get out of this? But I'm so exhausted, I'm so tired, I don't, and they're doing other habits that are not particularly healthy and so forth. So, yeah, I don't know if that sort of answers your question, but yeah. But I think when people have particular crises in terms of their private life, family or other kinds of things, you don't get away from that by going into the office or the laboratory or, wherever sort of thing. And so I think how you cope with it, how you handle it could affect your work in the other way. But what we were seeing was much more, the reports were much more the other direction. So, yes.
Two more.
Right.
Yeah. Is there a relationship between burnout and employee turnover? Is one a proxy measure for the other, or are they two separate?
Okay, so is employee burnout a proxy for turnover? Can be used as a proxy, how it's related? Yes, there's a lot of research evidence that says that if you burn out, you want to get out, and so it does predict turnover. It predicts not only leaving the job, it predicts other behaviors ahead of time, like spending a lot of time looking for jobs, even if you haven't left, and not doing your actual job, but trying to figure out how to get out of here, that sort of thing. It is not a proxy, though, in the sense that there are a lot of reasons why people will leave a job. And so, in some ways, some of the people I worry about a lot are the people who want desperately to get out to somewhere else, something else, and can't. And they're stuck there. They have to stay. There's not another job. They're dependent on that income. They've got so much sort of the, invested in, retirement and other kind of things that it's like a golden handcuff, kind of thing. It's keeping you there because you're not going to get that somewhere else. You get healthcare benefits or something like that. You're in a place where, say, your spouse is working and can't leave, and so where your choices, there's a number of reasons why people would like to leave and find something better and can't. And so I don't know enough about what happens to them in terms of how they're doing their work, how they're coping with it, et cetera. So that's why I can't say. But is it linked to turnover? Yes, it is. And in fact, I think somebody mentioned in an earlier meeting that that in some professions, and I think this does happen, like I think she was talking about nursing, people coming in wanting to go into nursing, and within the first few years, 5 years, having a big turnover. A lot of professions are like that. There's a big, and the people who stay for a long, long time, people think, oh, those are the ones who burn out because they're there forever. Actually, the people who last a long time, in general, are the ones who figured out how to manage this and do well. What you've got is a selective dropout of people for various reasons, having issues or problems or, whatever. So it's not the length of time, per se, that it is a proxy either. Okay.
Is there a difference, or have you seen one as it relates to gender or race and ethnicity in terms of burnout and how it impacts?
In general, the answer is there is not big differences. Burnout looks pretty much the same for men and women. It looks the same for people across different, ethnicity and different. What's more important, I think, are things that can be related to those variables, but not the variables themselves. And I'll give you one example. I did work with the Social Security Administration, and we were looking at service reps, telephone service reps, and all this kind of thing. And what we were finding for, I think it was the service reps, is that we were seeing a sex difference in terms of how satisfied and happy people felt about the job. And the women felt really good, the men did not. And of course, you're saying, okay, what is it about males and females? Well, it isn't anything. People were saying, oh, well, women are more emotional and maybe blah, 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 kind of thing. To go look at the data and sort of say, what's going on here? And we tracked the path of those people. And it turned out that the women had mostly started out at the lowest rung in Social Security. They might have been a secretary, administrative assistant. They'd worked their way up. They got training. They got this job. Really nice job. Good Social Security, health benefit, all these kind of things. This was a real, they had worked longer, and they'd gotten up to a much better position than where they started. So they were pretty pleased and proud of what they were doing. The men, we looked at them, this was their entry-level job, the first job they got. And they were saying, well, no, I'm not going to stay here. I'm going to go on to something else. But the point was they had very different paths which are related to gender. Why was it the women had this other, got to work yourself up over years? The men, this is where they started. So there's some other things that are related to it. And that's interesting to know, but it's not saying there's something inherent about being male or female per se that, people saying, what is their experience? So it was this different career path kind of thing. With respect to ethnicity, there's not been enough research to really get large enough samples within occupations to really look at those things in more depth. But when we did look at it earlier on, it turned out that there were some groups, they were smaller in terms of the number, so we had to be sort of careful about that. But African Americans and Latinos didn't show as much of a problem with burnout compared to their cohort in the same occupation in terms of being both Asian and white. You have to make sure you're not comparing nurses with doctors, that you have to control, and that's hard to get enough people within a particular kind of job and make sure they're doing the same thing, and then look at that. And so it was an intriguing kind of finding. I haven't followed up on it, and I don't know, and this was years ago, so I don't know if it's changed or something. But it was a really different response to dealing with some of those stressors. So if you have ideas, I'd love to hear. Yes, okay, one more, yeah.
In graduate school, there was a high focus on using the emotional and motivational formula to measure value.
Mm-hmm.
Is that the same one that was utilized for job burnout? And if not, would job burnout apply toward the emotional aspect of that formula?
I don't know that other measure, so it's hard for me to give you a good answer on that. But I think part of our challenge is that what came out of all of the interview work that I first did, and then sort of saying, okay, how do we capture this in a measure, and how do we validate that that's getting the experience that people are talking about, that we came up with these sort of 3 interrelated dimensions. And people have tried to change that because that's complex, and they wanted to add up the scores, and you can't add up the scores, and all this kind of thing. So people have simplified other things, and they may have used only some component of that, like the emotional exhaustion, or other measures that were getting at that in terms of the value. So that may have been what's going on. So I'd be cautious about leaping and saying it's burnout. You know what I'm saying? Does that make sense? Yeah. Okay.
Thank you so much.
Okay. Thank you.
UTMB Health, working together to work wonders.